So again, in my practice, I had a bias right away to be looking at that and thinking about that and reflecting on how forensic practice and services across Canada are impacting these individuals. And I had the opportunity to work in the Ontario system as well as the system in British Columbia, which there are some strengths on both sides that I think are kind of important that we're sharing. But some of the areas that came up the most, the biggest one, of course, I'm sure you're not surprised to hear, is the diagnostic challenges. So there's a significant number of studies out there and research looking at some of the overlap in symptom presentation between autism and schizophrenia, or autism and some of the personality disorders. So you can imagine that when someone's coming into the forensic system, if they don't yet have an autism diagnosis, the psychiatrist or the treating team that's assessing this person may see some symptoms and call them something else. So an example I've seen quite a few times in my clinical practice in forensics is somebody coming in showing some flat affect, so reduced emotion, what is perceived to be a reduced motivation to engage in social emotional relations, and some challenges in social communication, and some saying some things that are perceived to be possibly psychosis, which may just be some echolalia behaviors or just some repetitive words that are being said. And then the psychiatrist or the treating team saying, okay, this looks like schizophrenia. It fits the negative symptoms of schizophrenia. Okay, move on. And so we're seeing there's a gap in knowledge in professionals working in forensics about what autism is and about considering that as diagnostic applicability for individuals coming through this system. And from a systemic perspective, there is obviously a huge variety in presentation of individuals with autism and their strengths and their challenges. And this I have seen has created some difficulty within the system about where to place these individuals within the system. So you can often see a lot of movement between units when there's not quite a fit, it doesn't quite seem to be working, and that it causes quite significant transition and can be very difficult for people, especially if they need some time to get settled into that routine. Of course, sensory differences as well. You can imagine that forensic inpatient programs can at times be incredibly chaotic. It's crisis interventions happening all the time, and a lot of different mental health challenges and personality challenges coming out in kind of crammed into one place. So the sensory input can be incredible, but then sometimes the sensory input is very, very low, and it's very quiet, and there's nothing really happening, and there's no way to get access to that. Thank you. So if you're on either end of that sensory spectrum, you can imagine that being an inpatient is not going to contribute to ongoing well-being and success through the system. Some researchers have recently started the conversation about assessment for criminal responsibility for individuals with autism, and are wondering if autism in itself should be a diagnosis that triggers a criminal responsibility assessment, even if the mental health diagnosis is not there. So looking at, was there actually criminal intent in these behaviors? So you can think about the stalking example. Were they actually intending to engage in criminal behavior? Was there actually a negative outcome that they were looking for? And so should it trigger a criminal responsibility assessment right away? Again, I know I keep saying this, but the evidence is quite limited, and so we would like to look at this a little bit closer and learn a little bit more about what we can do. So the take-home messages for today, I think it's quite important that we're thinking about preventative interventions. So how can we as clinicians, but also individuals, families, and communities, how can we support people to enhance their well-being, enhance their mental health, and reduce their opportunities for entering into the criminal justice or the forensic system? And then once they do get into the system, how can we increase the supports and improve on the interventions that are being given? How are we thinking about autism in the context of forensics? And how are we providing those supports or making accommodations that might be needed for individuals with autism as they're in the system? advocacy and education with forensic professionals. I think that, as I said, there is a bit of a silo happening with developmental services, mental health services, and forensic services. So, some information, I think, needs to be shared with people working in forensic practice so that autism is considered as a potential diagnosis or as differences for treatment. And again, increasing conversations between the individuals who come into the forensic system, their families, and professionals. So what actually are the experiences of people who end up in the forensic system? What are we doing really well? And what can we improve on, and what can the changes be? Okay. Thank you.